Hello, I'm Dr. Dennis McKenna. I'm joined today by Rebecca O'Donnell, Director of Epidemiology. You've been here for 19 years. Welcome. Dr. Roop Dey, President of our Faculty Physician Group. You've been with us for 12, but importantly, you're also an anesthesiologist.
I am.
Great, thank you. So today we want to talk about two different populations that we are serving. One is the patients and their visitors, but importantly, we're also talking about our workforce. And so we're going to talk about personal protective equipment, and we brought two content experts here today to talk about this very important issue. So Rebecca, we'll start with you. So if you're a member of the workforce and you're coming into work, can you go over again the rules of who should and who should not be coming into these buildings?
Absolutely. So we've required healthcare workers to monitor themselves for symptoms once a day. Those symptoms include fever, shortness of breath, and cough.
So what's the definition of a fever again?
100 degrees.
Okay. And where are those individuals checking their temperature when they come into work?
So when they come into work, they can report to their unit or department.
And there are thermometers there?
There are.
And a way to record it. Okay. Now let's take a person who's at work so they don't have those symptoms you described. And they're in general public. They're like us. Is there any level of precaution that they need to have?
No.
So no masking to be in the hospital as long as you're not taking care of patients?
Correct.
Okay. Now, so let's take it to the bedside. You're taking care of a patient. That patient has not had COVID-19 and you're not working them up. They're not a patient under investigation. What's the level of precaution that our workforce needs to take care of that population?
So this is business as usual, and we use standard precautions. So any personal protective equipment to protect yourself from the patient's bodily fluids.
Okay. And what would that look like if there were bodily fluids? What would you have to wear?
It could include gloves, a gown, mask, and eye protection.
And standard precautions, we've always had those here?
Correct.
Okay. So Arup, same population. They don't have COVID-19. They're not a patient under investigation. Anything different in the operating theater?
Nothing different in the operating theater. So just like Rebecca said, eye protection, mask, gloves.
Okay, standard operating procedures.
Standard.
Are there any higher risk procedures, though, that we need to be concerned about today?
That's a good question. So as agreed to by a multidisciplinary group including epidemiology, anesthesia, ENT, pulmonary critical care, and respiratory therapy, we developed a consensus document for agreement on these special procedures. So these include, for the normal population, that may be at risk for the highest amount of aerosol generation. So thoracic surgical cases that involve a double lumen endotracheal tube and bronchoscopy, EBUS or endobronchial ultrasound, procedures in the ENT world that involve nasopharyngolaryngoscopy. So for those subset of procedures only, we're recommending N95 eye protection gloves.
Okay, and this document you're referring to, this consensus document, that's going to be available for people to read?
Correct, that's going to be on this transmission.
Okay, very good. All right, let's go back to you, Rebecca. So now let's take the population that is known to have COVID-19 or they're a patient under investigation. Does that change things?
It does.
Okay.
So with those patients, we would use enhanced droplet and contact precautions. Healthcare workers are required to wear gloves, gown, mask, and eye protection.
Okay, very
A
good.
regular surgical or isolation mask.
Not an N95?
Correct.
Okay, we've had enhanced precautions in the past as well.
We have. Now, if those patients require aerosolized generating procedures, we would use an N95 respirator with those particular procedures on those positive or patients under investigations.
And what's an example of an aerosolized generating procedure?
So like the list I went through before, it's those, and in addition, they include upper endoscopy, open suctioning, intubation, and extubation, as well as tracheostomy.
Okay, very good. Thank you. Thank you both. So that's a lot of information. We hope that this was helpful for you. If you have any particular questions after watching this video, we encourage you to go to the covid19@amc.edu email. You could send an email to that group. We'll make sure we review it, and if there's any need for further clarification, we'll reach back out to you. Thank you both very much. Once again, we ask you to take care of yourself, take care of each other. Have a good day.